So this week we're talking about safety when working with small animals in general. We are going to start out with talking about zoonoses, which are diseases that can be transmitted in between animals and people. So the first one that comes to mind might be kind of an obvious one is rabies, and it is a virus, and it affects the nervous system. It basically shuts down your nerves. It is contracted from bites and scratches of infected animals. You can get it from your dog or cat, but if they're vaccinated for it, they won't catch it and you won't be able to get it from them. If, say, you get bitten by an animal and you don't know if it's been vaccinated, if there's ever a doubt of whether that animal's been vaccinated or not, you want to go ahead and get immunized for it. Now, I will say, treatment for rabies is not pleasant for humans. And I sincerely hope that there are great advancements in treatment in the near future. But it is a series of 3 vaccines, if I remember correctly, straight into your stomach, which sounds very unpleasant to me. 93% of reported rabies cases were in wild animals. Again, especially in here in North Carolina, it's actually a law that you get your animals vaccinated against rabies, so we really don't have an issue. In our domesticated species, it's mostly wild animals. Children they're younger children, ages 5 to 9, make up less than 9% of the population, but they receive almost 30% of animal bites. And if you think about it, it kind of makes sense because, who's most likely to go up to a cute little raccoon and try and play with it? Probably a child. They don't really have a whole lot of awareness of fear. They don't have that kind of questioning that you get when you're older and when you're kind of like, this might be a bad idea. They don't really have that yet. So they'll go up to a strange dog. They might go up to a raccoon thinking that it's cute and will play with it. Something like that. Most domestic animals are really not likely to be infected with rabies, just as long as they're vaccinated on a regular basis. For our dogs, they get a 1-year vaccine when they're a puppy. And then every time you get vaccinated for rabies after that, it's a 3-year vaccine. So the vaccine itself is good for 3 years. So toxoplasmosis, this is actually a disease that's produced by a specific parasite called Toxoplasma gondii, and it is spread through contaminated litter or cat feces. And you'll find there's kind of a theme with these diseases and these zoonoses. A lot of it is spread through feces. So basically, just don't handle poo and you're okay. It doesn't really show up as long as the human immune system is working properly, but it can be a concern for pregnant women. So if there's a woman that's pregnant, she needs to be wearing rubber disposable gloves to clean litter boxes. She needs to be washing her hands after cleaning the litter box, or she could just get her husband to do it for her and then she doesn't have to worry about it. But it can cause miscarriage in pregnant women. It can also cause babies to be born either prematurely or blind. So up here in the top left, I have the life cycle of the parasite itself. And then in the bottom right, I actually have an eyeball of an infant that has been affected by that Toxoplasma gondii parasite. And this is the result of toxoplasmosis, and this poor individual is blind. Ringworm. So ringworm, unlike its name, it's actually a fungus, it's not a worm. And it shows up as these nasty, round, scaly, encrusted, lesion-y things on the skin. And if you're looking at it from an animal perspective, you are going to see hair loss right around that lesion as well. For some odd reason, pretty much any animal can get it. Dogs, doesn't matter. But for some odd reason, I find that it shows up mostly in cats. I'll be honest, I don't know the reason for that, but I just seem to find that cats end up getting it quite a bit. Psittacosis, or parrot fever. This is a disease that's contracted by caged birds, particularly parrots and budgies and other related ones. Humans can become infected through, again, contaminated feces or fecal dust. You want to wear a dust mask and a face shield if you're cleaning cages if you think there might be a danger of infection, say if you don't know the bird or something like that, and you want to protect yourself against it. Parrot fever can also be prevented by eliminating lice and mites and by spraying disinfectants on bird feathers. So cat scratch fever. Cat scratch fever it's a non-serious disease. It's one of those where, you know, you get bitten by a cat or scratched by a cat, and that area where you were bitten or scratched becomes swollen and sore. Maybe not necessarily infected, but just uncomfortable. That's what cat scratch fever is. It's not contagious from person to person. It's not necessarily a virus or a bacteria or anything like that. It's just the reaction that your body has to a cat scratch or bite. Salmonellosis. Salmonellosis is a disease that actually comes from the Salmonella bacteria. Can be transmitted to humans and animals. For the most part, the children and elderly are most at risk. That kind of goes for any disease we talk about here. Pet turtles and reptiles are a common source of infection in humans. So this is why you don't necessarily want to go out in your backyard and get a box turtle and keep it as a pet. It could be carrying salmonella. Rocky Mountain spotted fever. This causes coagulation of the blood. Coagulation is just a fancy word for clotting. So it ends up basically causing small little blood clots everywhere. Symptoms include things like fever, headache, nausea, vomiting, skin rash, and death if you don't treat it properly. And it can be caused by the American dog tick, and there's actually 6 other tick species that carry it, but the American dog tick is the most prominent. Lyme disease, also a tick-transmitted disease, it's a bacterial disease, and it results in this very distinctive bullseye rash skin lesion. It can also come with hives and flu-like symptoms. You're going to feel kind of achy muscles, stiff neck, fever, fatigue, chills, painful joints, that sort of thing. We will talk about parasites in the next video.